On February 18, 2010, FBI and Pennsylvania State Police stormed the doors of the Women's Medical Society clinic. Dr. Kermit Gosnell, the owner of the clinic, was being investigated for months under suspicion of illegal drug prescription distribution. However, what the police uncovered during the raid was far worse than what they had expected. The abortion clinic was extremely unsanitary, with animal feces, blood-stained blankets, and half-conscious moaning patients everywhere. Fetal remains of 47 victims were scattered throughout the clinic, stored in horribly unsafe and unsanitary ways, some even found in cat food containers. Multiple of the remains were infants that would have survived if not for the cruel actions of Gosnell. Prior to the day everything fell apart, Gosnell had spent decades as a strong advocate for abortion rights. But this is not a case of debate between pro and anti-abortion. This is a case of extreme negligence, greed, and human lives lost. Gosnell received his medical degree in 1966 and spent the next 40 years practicing medicine in poor communities in Philadelphia. In 1972, he opened his own abortion clinic called the Women's Medical Society. That same year, he performed 15 second trimester abortions on television. He used a dangerous, untested method for these abortions, called the supercoil. The method used a strip of 97 small plastic razors that were coiled into a ball and inserted into the uterus. After hours passed, they would expand due to moisture and cut up the fetus, expelling it. On this day that would come to be known as the Mother's Day Massacre of 1972, Gosnell caused severe lacerations, infections, and intense bleeding to many of the women. 9 of the 15 women had to be hospitalized due to complications after the procedure, and 3 of those 9 women experienced life-threatening issues requiring major surgery. One of the women even had to receive a hysterectomy. This was Gosnell's first blatant instance of negligence and dangerous behavior, yet he was not reprimanded. From then on, he escalated his behavior and went on to commit atrocities far worse. At this point, Gosnell was still regarded as a respected member of the community due to his work with teen aid programs and a halfway house he opened. But over the coming years, public opinion of him shifted when word spread of what went on at the clinic. While his community efforts may be seen as noble to some, he was largely motivated by greed and preyed upon poor minorities and immigrants. In Pennsylvania, it is illegal to perform abortions after 24 weeks of pregnancy, yet Gosnell disregarded this rule entirely. He would charge between $1,600 and $3,000 for late-term abortions. However, this was not his only lucrative business, as he was also very involved in illegal prescription distribution, making between $10,000 and $15,000 per day. He would sign blank prescriptions for controlled medications, and the names of the patients would later be filled in by unlicensed staff. Throughout his career, he illegally distributed more than 500,000 pills containing oxycodone, 400,000 containing alprazolam, and more than 19,000 ounces of cough syrup containing codeine. Over the years, Gosnell had 46 lawsuits filed against him over a multitude of reasons. He hired untrained, unlicensed staff to run his clinic, which was kept in horrible conditions. It had outdated, unsanitary equipment and rooms, and on many occasions, STDs and sepsis were transferred due to improper cleaning and reuse of equipment. He performed hundreds of abortions past the 24-week mark, and in many cases, the child was born alive. Gosnell would then create an incision in the baby's neck and sever its spinal cord with scissors. This is by no means a standard medical procedure, but rather a cruel act of violence and murder. This allegedly happened to hundreds of babies over 4 decades, but due to tissue deterioration and poor file management, evidence was only found of 3. Other bizarre instances of negligence at the clinic included unlicensed staff with no medical training giving labor-inducing drugs to women, then setting them on the toilet. The women would then expel the fetus into the toilet, then be sent to the recovery room where they were sat on dirty recliners with blood-stained blankets for hours. The staff would fish the fetus out of the toilet so as to not clog the plumbing. However, Gosnell's victims were not all babies. The mothers often suffered a similar fate. In 2009, Gosnell and his staff committed third-degree murder against Karnamaya Mongar. She was a 41-year-old refugee who had moved to the area that year. While at Gosnell's clinic, she was administered with Demerol and anesthesia several times due to poor record keeping. Gosnell, being the only real doctor at the clinic, was required to be there, but allowed his untrained staff to do it instead, something that happened very often. Mongar received a lethal dose that resulted in the 90-pound woman's death. Staff attempted to revive her, but failed due to an outdated defibrillator that no longer worked. An esteemed anesthesiologist later testified that the dose she received was outrageous and would have killed even an average-sized person. Another woman who fell victim to Gosnell was a 15-year-old girl who came to the clinic with a relative in 1998. After she entered, she changed her mind about getting an abortion, but Gosnell would not accept this. He allegedly ripped her clothes off, restrained her, and told her, "This is the same care that I would give to my own daughter." 12 hours later, she woke up at her aunt's house, robbed of her child. Another woman in 2001 received an abortion at the clinic, but experienced complications 4 days after. She returned to the clinic because of extreme pain, where she was given an ultrasound. At this point, Gosnell discovered that he hadn't removed all the fetal remains from the uterus. He suctioned them out without giving the woman anesthesia, as she prayed in agony for the Lord to help her through it. It's baffling that this had gone on for over 4 decades with no law enforcement stepping in to stop it. However, it begins to make sense upon learning that Tom Ridge, a pro-choice Republican, took office as Pennsylvania's governor. He stayed in his position for 15 years and ceased routine inspections on abortion clinics. He wanted the barrier to get an abortion to be as low as possible, with inspections only happening after a complaint. However, the complaint process was extremely detail-invasive and hard to submit, deterring anyone who had a complaint. This allowed ruthless crimes to go on among any of the 22 abortion clinics in the state, but especially in Gosnell's clinic. Gosnell was finally caught due to authorities catching wind of his prescription drug distribution, which had made him a multi-millionaire. During this investigation, they also uncovered the suspicious death of Karnamaya Mongar. During the raid on February 18, 2010, they discovered much more. The team that raided the property described the clinic as filthy, deplorable, disgusting, very unsanitary, very outdated, and horrendous. There was a flea-infested cat wandering the property, cat feces on the stairs, blood all over the floor, and sedated women waiting for abortions in blood-stained blankets. Gosnell was not even present at the clinic, and it was discovered that the women had been sedated by the staff, none of which were certified to do so. Most medications found in inventory were all past their expiration date. Surgical rooms were filthy and covered in blood. All equipment was out of date, rusty, and untested. Fetal remains were found in miscellaneous containers such as bags, milk jugs, orange juice cartons, and even cat food containers. Jars were found containing severed fetal feet, which Gosnell claimed were for DNA samples, though a small piece of tissue would have sufficed. Fetal skulls with incisions at the base of their neck were also uncovered. Medical waste was found piled haphazardly in the basement. And finally, emergency exits were padlocked. Gosnell's license to practice was finally suspended 4 days after the raid. However, he was not arrested until 11 months later, on January 19, 2011. He was initially charged with 8 counts of murder. The case alleged that he had killed 7 babies that were seen breathing or crying by severing their spinal cords with scissors. Of the 7 babies, physical evidence was only found for 2 of them. A picture of the 6th baby's severed spine was found, and the 7th baby's remains were obtained. He was also charged with the murder of Karnamaya Mongar. Not only was Gosnell arrested, but so were 8 other suspects on his staff team, including his wife, Pearl. During the trial, Gosnell claimed to be nearly broke, yet he owned more than 17 properties across 4 states, one of the properties being a $1 million home in New Jersey. The business he had run for 4 decades had made him an incredibly rich man. Unfortunately, due to lack of evidence and destruction of files, Gosnell was only able to be convicted of 3 counts of first-degree murder and 1 count of third-degree murder. It is likely that the actual number is much, much higher, though these charges did still land him 3 life terms in prison. He was sentenced to an additional 30 years in his drug distribution trial. In addition to Gosnell, there were 10 co-defendants in the trials that are shown here. Hundreds of charges were levied against Gosnell and his staff. They had sentences ranging from 1 year of probation to 10 years in prison. Gosnell will go down in history as one of America's most prolific serial killers. A twisted man who took the lives of hundreds of infants within minutes of their first breath.